We're here to talk about different types of arthritis. People say they have arthritis, but what type? It's really important to know what diagnosis we're dealing with. There are about 100 types of arthritis people don't realize. And some are obviously more important and more frequently seen than others. But when we're dealing with arthritis, we want to know what type, just like we want to know what type of infection you have or what type of any illness you have. Honing down on the right diagnosis is very important in treatment. So the most common type is the wear and tear osteoarthritis, otherwise known as degenerative arthritis. It's what people get in their knees and in their hips. It's a tribute to hard work in many people. Many people have earned it by activities, football players, farmers. So it's the type of wear and tear arthritis where the cartilage gets worn down. So that's the part of the joint that's affected in osteoarthritis. Now that's in opposition to rheumatoid arthritis. Rheumatoid is a more aggressive type of arthritis where you have inflammation of the joint lining, as a term synovitis, which means inflammation in this lining of the joint. And this is a more destructive type of arthritis that may require more aggressive treatment, such as the ones seen on TV, Humira, Enbrel, methotrexate, that sort of thing. So that is a more aggressive type inflammatory arthritis, whereas the other is more degenerative. Now, another one is psoriatic arthritis. People are familiar with psoriasis of the skin, and you would wonder how the two are linked. Well, the proteins in the joint lining are similar enough to the protein in the skin that they're both the battleground areas for this type of inflammation. It's not an infection, it's an inflammation. And it can be a destructive type of problem. So about 20% of people that have visible skin psoriasis may have joint involvement as well. So it's important to be aware of that. Now, there are other types of arthritis that are inflammatory. There's gout, and there's also false gout. Gout is due to too much uric acid in our system. We all have uric acid in our system, but people who have too much get gout, and it's in the toes and fingers more often. It's a dramatic type of arthritis. It's not subtle, it's dramatic. It's a very intense pain that comes on suddenly. And dietary indiscretion or bad luck can happen if you get dehydrated, if you take too much alcohol, too much tailgate food, we'll call it. Then that type of material is broken down into uric acid, and you get too much in your system. It actually forms visible crystals that the rheumatologist can see if he looks at it on the microscope. False gout is somewhat similar. The crystal is different. It's a little bit more subtle, not quite as aggressive, but folks in their 70s and 80s can get false gout. They may have an inflamed wrist or an inflamed knee, but it's a pretty acute type of arthritis as opposed to the earlier degenerative arthritis, which is a gradually moving process. Now, another one we have to rule out is called fibromyalgia. It's not a true type of arthritis, but rheumatologists and internal medicine doctors see fibromyalgia. It's a painful condition. It's a pain perception problem that can mimic arthritis. Your lab tests, your x-rays will be normal, so we have to use clinical criteria, as we say. Now, most rheumatologists, to digress for a moment, will make a diagnosis about a third based on what the patient tells them, the medical history, as we call it. About a third on the physical exam, and about a third on lab tests and x-rays. There's a tendency in the technical age to think we just do lab tests, x-rays, and that's it. But you have to make all three of those components fit, particularly so in fibromyalgia, because the historical facts are very important. These individuals will suffer with painful muscles in various parts of the body, shoulders, knees, hips, but you won't have any redness or swelling. So it takes sort of a trained eye, and you're always ruling out mimickers when you're dealing with fibromyalgia diagnosis. Now, another illness is called osteoporosis. Now, it is not a true arthritis either, but it fits in the realm of what we do. Osteoporosis is thinning of the bones, whereas the osteoarthritis, the basic type of wear and tear arthritis, is narrowing of the cartilage. This is thinning of the bones themselves. And it happens frequently in women and in men as they go through the years. Women in their 50s lose the beneficial effect of estrogens and their bones and become thinner. And prevention is the real key here because we want, as a rheumatologist, we want to maintain function, we want to lessen the pain, and osteoporosis is key for that. You don't want to fracture a hip because your functional level will really go down. So this is prevention. Calcium, vitamin D, other medications are very important, and a bone density can tell us a lot there. Others that we have on our list to finish out our top 10, there's something called Sjogren's syndrome, and this is a type of inflammation that affects the joints, the skin, but particularly dryness of the eyes and mouth. And it may be similar to lupus, but we call it a first cousin to lupus. You might say it doesn't have all the features. Lupus, however, is a more aggressive type of arthritis that can involve the skin and the internal organs. So lupus can be a very difficult type of arthritis to treat. It may give you an anemia, fatigue, rash, painful joints, and in the roughest cases can affect the kidney and the neurologic system. So that's an important one to diagnose. And for that reason, we want to be sure what we're treating. We don't want to think it's gout when it's lupus. We don't want to think it's wear and tear arthritis when it's rheumatoid arthritis. And in sifting through this, there are some good sources such as the Arthritis Foundation websites, arthritis.org, that list all the issues I've talked about, plus about 20 more. They don't have all 100, fortunately, but they'll have the most common types of arthritis, and that can help you be informed so you can talk with your internal medicine doctor, your family practice doctor, and see a rheumatologist if you need to.